Dr. Marina Straszac Suri. She is one of the experts that we love to talk to when we have questions. Dr. Suri is an obstetrician and a gynecologist. She has been in practice for over 30 years. She is actually currently an assistant professor at the University of Ottawa in the Faculty of Medicine. And Dr. Suri is one of the people that trains the young medical professionals that are coming out of Ottawa U. Welcome, doctors. Marina.
Thank you, Radha. That's a very nice introduction.
My pleasure.
What I want to add to that is when it comes to teaching, the people I teach who are the most important are my patients. So I love to teach trainees, but patients need a lot of guidance as well. And I think that's, the word doctor comes from teacher in Latin.
Really?
So, yeah, that's what medicine is supposed to be. We're supposed to teach people how to be healthy.
Isn't that amazing? The word doctor means teach in Latin.
People forget that being a doctor is teaching. And my patients have a lot of questions for me, and that's how I get them to change their lives. Because, in fact, to be healthy, there's a lot of things that you need to do, and it's not talked about very much in medicine.
I think one of the reasons I was very excited to have you here is precisely that, is that there is a lot of concern, there's a lot of questions that people like me who are non-medical professionals or just living our lives trying to live the best kind have questions about. And I feel that there's a lot of times that the medical professionals are not able to answer those questions. Sometimes it gets tougher to have those conversations. Do you feel that you come across that?
Oh yeah, I mean that's a big problem right now because there's too few doctors. So the doctors that are there are overworked, they don't have time. In our payment system, we get paid for seeing patients and doing activities, and there's an awful lot of pressure to try and do these things quickly just to make ends meet. So that's part of the difficulty. Patients don't have enough time with doctors, so they're seeking help elsewhere. Often, with naturopaths or more holistically trained practitioners who often have a bit of a different view of things as well. And I think that's very helpful. I do a lot of my training in areas where there are naturopaths as well, because I have an interest in what's called functional medicine. I've been interested in this for over 20 years. It's a different approach to medicine.
Yes.
It's a roots cause approach.
Yes.
And a lot of naturopaths and chiropractors are interested in that form of medicine. So I meet them at a lot of educational meetings. And I incorporate a lot of that into my practice because I think that that's a much more holistic view of things, and it's much more helpful for patients to be able to look at everything, not just try to find a pill that solves a problem, because that's not the answer to what's going on. We're having such medical problems now because of the environment we live in, and we have to address that.
I didn't say it, folks. The doctor said it. You said you've been interested in functional science, the science of functional medicine, which is basically root cause. What's the other that you just explained? But what is the other one called, the one that does not do the root cause?
I call it conventional medicine.
Conventional medicine.
Some people call it traditional medicine, but in my view, that's not traditional. Traditional is more Aboriginal medicine and traditional to certain countries like Ayurveda or traditional Chinese medicine. So I think conventional medicine is a better word for it here in North America.
So more like a symptomatic approach to what is the symptom and then this is how you cure the symptom.
Exactly. It's diagnosis and try to find a pill to answer the question. And unfortunately, that's a very limited view of things because medical education is largely driven by the pharmaceutical industry.
Yes.
And that's unfortunate. We have taught people to expect there to be a pill to solve every problem.
Yes.
And there's not. There just isn't. So we have to look at other issues. Lifestyle is fundamental to our health, but most physicians are not aware of how to approach that. So they don't even want to talk about it.
When you say lifestyle is a very major contender in the process of figuring your health and wellness.
Well, there's different aspects to lifestyle, right? And I would say the major ones are diet, exercise, stress management, sleep,
I love that. Mhm.
avoidance of toxins in our environment is a huge one. So those are the major issues, but obviously there's lots to consider within each area which you have to learn about.
Okay, I love that you broke this down. So I have questions. Okay, when you say diet, you're not talking about dieting.
No, I'm talking about what you eat on a day-to-day basis.
Okay. When you say exercise, are you talking about going and getting yourself a personal trainer exercise, going to the gym exercise, or like any daily kind of exercise, a movement? Is that what you're talking about?
Any physical activity is important to your health. Now, whether you want to do it in a structured, repetitive way by going to the gym, or you walk every day, I mean, it all counts. Again, there's different aspects to exercise, right? There's strength training, there is endurance training, there's cardiovascular activity, there's balance. Those are all elements of exercise, and we should be trying to incorporate all of them in order to be physically fit.
So you said balance.
Very important as you get older. Well, particularly in older individuals who start losing their balance because they don't work at it. They're more prone to falls, and fracturing a hip is like, it's almost a death sentence for an older individual. I think it has 50% mortality. So if you want to live longer and you're in your 70s or 80s, balance is incredibly important.
Is that something that you can grow in that age, or is it something that you need to work on prior?
I think it's much easier when you're younger to work on it, and it's not emphasized enough. But, there's a lot of activities like yoga or Tai Chi that incorporate balance as part of the activity. So doing those things can really help.
That's wonderful. You mentioned toxins. I sometimes feel we're the outsider in the world of toxins, and they are everywhere and in everything, but we are blinded to it due to different reasons. Pharmaceutical industry, consumers, consumerism, big corporations making lots of money about different things, and everybody profiting on our bad health, which is pretty much what it is about, I think. When you say toxins, which ones do you believe that we can, or we should be able to avoid at a minimum? If you have examples in regular day, household things, food, whatever.
For sure.
I would love to get an example.
Okay, so if you want to break that down, there's toxins in our food, our air, our water, and the products that we use in our household, whether it's personal care products or cleaning products, they are full of toxins. So a lot of companies try to make their products look better. It's called greenwashing. They say it's natural, or it's it's free of this substance, but then it has another substance which may be even worse. So I refer a lot of my patients to the EWG. It's the Environmental Working Group, which is a not-for-profit organization in the United States that educates people about pollution in the environment and what to do about it. One thing that they do is they have guides into how to choose good air filters and water filters. I think we're at the point now where we should have air filters at least where we sleep at night, because we spend hopefully 8 hours a day at that point. So that is the obvious place to have a good air filter. But I think it's necessary.
So, we live in Canada, and these houses have central air, and we have filters. So are you saying that may not be enough?
I don't think it's enough.
Okay.
And not only, is the air polluted, indoor pollution is worse than outdoor pollution, because we buy furniture that has, fire retardants in it. The drapes we use have fire retardants. There's toxic stuff in all of the things we use. Plastics.
What is fire retardants?
So, furniture and even clothing has specific codes now, so that, if you were to have a household fire, that it doesn't burn as quickly.
Oh.
Yeah. So, but this stuff is toxic.
Well,
Okay,
I would
our
assume.
furniture, it's on our furniture. We breathe it in. It's in our rugs. And
Wow.
so it's scary. It's scary when you know about this stuff. Our bodies are actually really, generally speaking, pretty good at getting rid of this stuff,
Yes.
whether it's through our urine, our stool, our sweat, our tears, our menstrual blood. All of it is getting rid of things. However, we all differ genetically on how we're good at that.
Yes.
And that's important. Now this information is coming out, and now you can learn about this. We differ in the way we metabolize drugs. We differ in the way that we metabolize pollutants. And some people are just not as good at doing that. And those are the people that have a lot of multiple chemical sensitivities. They react to perfumes. They react to different products. We used to think 20, 30 years ago that these people were making it up.
That they're crazy.
That they're crazy.
Yeah.
A lot of doctors treated them that way. But unfortunately, it's happening more and more. It's causing autoimmune diseases, which have multiple repercussions in terms of your health.
Yes.
So it is important that we address this. You can't escape it. It's part of our life, right? But there are things that you can do to make it better.
And putting an air filter in the room that you sleep is one of those things to make it better.
Those things.
Putting water filters is one of those things.
Good quality water filter. And there water filters, I mean, there's Brita filters, which
Yes.
are sort of the lowest.
Yes.
But at least it's something, right?
Something.
And then you can work up to reverse osmosis filters that are very expensive. So you have to find what you're willing to pay, what you can afford, and what works for you. But I would address that. I address that in all my patients.
Do you use the filters yourself, doctor?
Oh, absolutely. I have a countertop reverse osmosis filter that I use for our drinking water.
So in India, these are the things.
Yeah, that's
They're
right.
called RO water, right?
right.
Because they're reverse osmosis.
Yeah.
What is reverse osmosis? You have an idea?
It's a complicated filtration system that it usually goes through 4 different filters. Well, at least mine does. I'm not sure they all work that way. And they filter different kinds of products in each filter.
Okay.
So I think the reason why they have this personally in a country like India is that they don't have good municipal water supplies.
Yes. Yep.
Now here we've gotten a bit complacent. We figure the water supply is fine.
Yes.
And of course they test for major contaminants. However, there's a lot of things they don't test for. Now you can imagine that we have, what percentage of the population is taking antidepressant medication? I don't know. It's a very high percentage. Well, the metabolites are going in the urine of these people, as are the metabolites of all the birth control pills people are taking, right? That goes right into the urine, into the municipal water, which gets cleaned to a certain degree. But are they testing for, metabolites of drugs? I don't think so.
I'm slightly mind blown right now. This is wow. And I believe that I think things a lot of in depth, but I'm sorry, what? Okay. Yeah. What are metabolites?
So metabolites is your body breaks down something. When you eat something or you take a pill, it breaks it down to get rid of it. So, it might use the component that's in the pill that you want, but your body will break down everything. That's called metabolization.
Okay.
And then it gets rid of those metabolites. But sometimes metabolites can be harmful.
For the body itself.
For the body itself.
Is that the autoimmune problem?
Yeah, so autoimmune disease is very interesting. That has a lot to do, the theory right now is, you may have heard the term leaky gut.
God, everywhere.
Yeah, everywhere. Okay. So basically, what happens when your gut is leaky, it is allowing substances to be absorbed into the body that shouldn't be. And your immune system says, hey, what's this stuff? This is not supposed to be here. And it attacks it. And that starts this sequence of, you start developing antibodies to different things. And the antibodies might be similar for something that's normally in your body. And that's what triggers autoimmune disease. So again, conventional medicine used to think leaky gut was a made-up term and used to think it was silly. Now it's calling it increased intestinal permeability, because that's a much nicer term. But now they realize that it's a thing, right?
Increased intestinal permeability. So like the stuff is getting through. The lining is not doing its job. And this, we're talking about the gut lining.
The gut lining.
And the gut lining is getting weaker. And
it's getting weaker because of the toxins, the pesticides, and the food that we're eating.
Is metal part of the toxins of the food that we're eating? I know plastic is, but is heavy metals?
Heavy metals definitely are in the air, in the water.
In the air?
Yes.
How can a heavy metal be in the air?
Because there's different forms of substances. So, you can have a gas or a vapor, a liquid or a solid. And heavy metals can even be dispersed through pollution in the environment, in the air.
That's... Okay. Well, like, I'm going to try and wrap my head around this. That's like extreme, like things that we don't actually ever think about.
No, not at all.
Like, this is a very in-depth analysis of a lot of the stuff. We were talking about lifestyle, and we've come to the conclusion of heavy metals in the air. People will be like, I'm going to put a filter in my room and sleep, not going out, not doing anything. Like, it's just like, you cannot live out there. Like, it feels like we're beyond humanity right now.
I don't want to scare you and make it sound like, we can't live in this environment. We can, but we have to help our bodies.
And so that was my question to you. So lifestyle, we tried to break down lifestyle. We talked about diet, we talked about exercise, and we have talked about toxins. What we have not talked about is that for a healthier lifestyle, or that one that will lead to a healthier mind and body. I want to say mind and body because they're connected. And you did mention that what percentage of people on antidepressants?
Actually, I can't give you a figure. It's high.
It's high.
Yeah.
It's high. Just that, and the autoimmune diseases that seem to be on the up right now. I find everybody I talk to.
There's over 80 autoimmune diseases now. When I started medical school, there were only a few that we knew about. And now I keep learning about newer ones. You can have antibodies to your neurotransmitters. That is very scary.
That is very scary.
Antibodies to your hormones. I have a patient who is allergic to the progesterone in her body. That's not a nice thing to have. And I had never heard of that before she came to me. I was totally shocked.
I really want to know how you cure this or how you're going to fix this, but we can't get into that right now. What? Sorry, I'm just taking a moment here.
And it's because she was exposed to synthetic progestins. She has endometriosis, and it's usually treated with synthetic progestins. And her exposure to that led her to develop antibodies to her own natural progesterone. So she gets these symptoms at the second part of her cycle when your progesterone levels are high. She gets hives and ulcers in her mouth, and so she's treated with medication, which is just trying to deal with the symptoms, because the only way to get rid of the progesterone would be to remove her ovaries, but she's so young that would lead her to all sorts of worse problems, other issues. Yeah. She ended up having a hysterectomy because of her chronic pain, but the decision was made to leave her ovaries in place because of her age. Now, I actually have put her on a treatment that is not well known, and she's doing extremely well on it. But it's a treatment that very few doctors know about. Medications, when they're first discovered, a drug company can put a patent on it for a certain amount of time, and it's their medication, and they make the money from it.
Yes.
But patents run out after a number of years, 20 years perhaps. So there is no incentive to research this old drug that was used for something else for new applications. Few people who were interested and knew about it started researching it for autoimmune disease because it's an immune modulating drug. And this actually is extremely helpful. It creates a bit of a problem to use these kind of medications off-label. You really have to warn your patients, like, nobody's going to know about this. If you go to hospital, you're going to have to, I make them sign a huge consent form,
Yes.
talking about the studies and what this drug does. So I really want them to understand, and particularly that they can't take any opioid drugs with it. Through my interest in functional medicine and longevity medicine, I have come across a lot of things that are not well known. And I've particularly researched the ones that are, of interest to me or may help my patients. And that's how I came across this drug maybe 10 years ago. Recently, last year, when I was doing research for my new book on fertility, I came across it in being used in fertility. And even though I was familiar with the drug, I didn't know it was being used in fertility. So it was only through doing this research that I came across it. And then I started using it more because of that.
Is there a statistic of higher levels or amounts of autoimmune diseases in women than in men?
Yes, there are. It's not fully understood why. It's thought to be to do with the hormonal milieu. But yes, definitely women have more autoimmune disease.
I would love to hear, be able to talk about hormones and the importance of them in a young woman's life the day she starts to menstruate.
Yes.
Can you shed some light on that?
So it's so interesting because I'm writing about this in my book. Menstrual cycles should be considered a vital sign. Vital signs are things like blood pressure, pulse, temperature. Those are vital signs. Your menstrual cycle is a sign of your health. And if it's working well, it's a sign that you're generally healthy. If it's not, there are problems. Nowadays, women, even from puberty, are having problems with their menstrual cycles. I now am diagnosing young girls who don't get their first period when they should because they have polycystic ovarian syndrome, which is a very, very common hormonal imbalance that I believe is being driven by pollutants in our environment to a large degree. Or at least, maybe that's not the cause, but it's making it worse, put it that way. So I'm now seeing girls who never get their first period because they have this. And, their mothers bring them in at 15, 16, and the diagnosis is polycystic ovarian syndrome, which is crazy. I never used to see it in this age group. But now I'm also seeing fibroids and in teenagers, which is crazy because it used to be women in their 40s and 50s. Menstrual cycle, incredibly important, especially for fertility. You need to have a regular, pain-free menstrual cycle in order to promote pregnancy. Now, maybe you can get pregnant if it's not so regular or slightly painful, but these are potential problems that young women are having, and they're either ignored. Some women are told it's normal to have painful menstrual cycles, which is not true. I think it's male physicians who are telling women that. I'm sorry to say, but it's being treated with the birth control pill, which will regulate your cycle and make it less painful. But it's not treating the root cause, getting back to functional medicine. It's not fixing anything. It's just glossing the symptoms over, which is what conventional medicine tends to do a lot of the time. Get rid of the symptoms and you don't have a problem, right? But the underlying problem is still there. So if you go on the pill and then, 20 years later, you decide, okay, I want to have a baby now, you get off the pill and the same problem is there. You're 20 years older and trying to get pregnant, and the problem has never been solved.
Oh my goodness.
So that's an issue. And now women are putting off pregnancy because of their careers, because they want to get more financially established. And their doctors are not informing them that they need to think about their menstrual cycles and make sure they're okay. So way before they want to get pregnant.
That was my question. Like when they go into the doctor to get the birth control pill, I think that the North American birth control pill situation is not okay. But it's out of control, and it's the thing that everybody seems to be on. When should, I mean, I think it's more for mothers at this point of time, because when the girls are younger, they're I mean, you're living a life, teenage life. Do you think I was worried about my menstrual cycle, having children? I don't think so.
No.
But somebody should be.
Yes.
So, right? So what approach do you think you could advise for either parents or like younger, like we know young girls that are in their late teens, early 20s that have some of these problems. And now we look at them and we're like, you know what, we need to figure out what's better for you. What is that suggestion? What is that advice that you would give to somebody in that age group?
Okay, well, it sort of depends what the problem is, but the two major problems are polycystic ovarian syndrome and endometriosis or adenomyosis. Huge. So, you know, I do some investigations. If they're coming to me because of these problems, I will do investigations to try to make a diagnosis of either of those things, and then try to offer advice of, you know, what can help the problem rather than cover up the problem. Now it depends. If they need birth control, obviously they don't want a pregnancy, so there are good reasons to go on the birth control pill. But it's being overused as a treatment for these problems in women who aren't even sexually active. You know, that annoys me. Why birth control pill can be considered an endocrine disruptor. It's synthetic hormones that don't work on our endocrine receptors or hormone receptors like a normal hormone. They're disrupting the health. They are not healthy. But I can understand the need for birth control. And, you know, I was on the pill myself and using IUDs myself because I didn't want pregnancy. So, you know, it's a bit of a quandary.
Is one better than the other? Is an IUD better than a birth control pill?
It's different. I mean, it has different side effects and different problems. There's no perfect method, right? There's going to be side effects and problems with each method that you try. And it depends on the situation as well. For instance, someone who has endometriosis really does not need extra estrogen. So going on a combined pill that has estrogen and progesterone is not a great idea. But a lot of family physicians aren't really aware of what the difference is and why it's not a great idea, because estrogen actually drives endometriosis and it makes it worse. And for some women, they will initially feel better on the combined pill, but with time, they will develop pain again because of the estrogen in the pill. So, you know, that has to be understood. But unfortunately, I don't fault family doctors. They are so busy. Yeah. They have to know so much about so many things. Yes. I'm in awe of them. But that means that they don't know about everything as fully, and yet they treat things without really knowing the underlying problems sometimes.
Purely because, like you said earlier, they don't have enough time, and the system, the way the system works here, although we have one of the best medical systems, it's just the way it works here is disruptive for personal one-on-one health, you know, help that anybody could get. Unfortunate. But I also think that we are on a ramp up to fix some of these issues purely because of awareness. And I think that's kind of why we're here today, is to help that awareness piece a little bit more. Yeah. You mentioned endocrine disruption. Okay. Can you explain that?
Okay, so endocrine disruptors are chemicals, mostly environmental pollution, for instance, but it's also in our personal care products and our pesticides, for instance. These are chemicals that work slightly like hormones. So imagine we have hormone receptors on our cells, and that's how hormones work, right? So it's like a lock and key mechanism, right? So the hormone fits into the lock and opens the lock and functions. So these endocrine disruptors will fit into the lock, but not properly. They might break the lock. They might open the lock and leave it open. They can have different, they act like crazy hormones, not like normal hormones, and they can have side effects. And the birth control pill is actually an endocrine disruptor because it's not bioidentical. a chemical synthetic version of the hormone.
Okay.
Now, for some reason, some people are more sensitive to endocrine disrupting chemicals than others. And again, that may be genetic factors that we don't totally understand. But certainly women now talk more and more about negative side effects of the birth control pill than they used to 30 years ago. So I'm not sure whether 30 years ago they would accept these side effects, or whether women are getting more side effects because of what's happening in the environment. But certainly I hear many more complaints about the side effects of pills than I used to.
So I also know that birth control pills get prescribed to you for acne.
Yes.
So I have hormonal acne right now. So I'm trying to work around that, figure out what I need to eat, what I need to take care of, what might be my issues hormonally. But there is no test. There is no real way of figuring out how your hormones are being, because it's a very symptomatic approach to hormones, because hormones change. Every hour, maybe every 2 hours. I don't know. I've been told that this like this. You just never know what's going on with them. So when we're talking about hormones and we're talking about endocrine disruption of hormones, you said bioidentical. What is the difference?
So bioidentical means it's identical in chemical structure to what's in your body. So I have estrogen and progesterone and testosterone in my body, and I can take an identical version. The problem is, and this is more of a factor in treatment of menopause, the first hormones that were made were synthetic versions, and that's what was used in hormone replacement therapy. But now, more recently in the last 20, 30 years, we have the exact chemical version, the bioidentical one that's in our body. And in my mind, if you're lacking a hormone, you should replace it with the identical one, not with a synthetic version. But pharmaceutical companies don't make money off of the bioidentical ones because they can't patent them. They can patent the synthetic versions. So that's what they make, synthetic versions. And they keep changing them and upgrading them because the patents run out on the old ones.
Wow. Okay. Are the bioidentical hormones available?
Yes. So some are even available commercially in every pharmacy.
Really?
So even some doctors are not aware of this. They're not taught the difference in medical school between bioidentical and synthetic, and they misunderstand. Some doctors think that you have to compound a bioidentical hormone, which means you have to make it from scratch in the pharmacy. But that's not true. We have bioidentical hormones that are available in every pharmacy. Now, there are also compounded hormones that are bioidentical, but you don't have to use them. You can use the ready-made ones.
Would the pharmacists know?
They should, but again, I think they have to have a special interest in women's health to understand the difference. Recently, I prescribed a patient a bioidentical progesterone, and the pharmacy made a mistake and gave the synthetic one, but the dose of the synthetic one is much, much lower because it's more powerful. They gave it at the dose of the bioidentical one. I would not have found out had the patient not brought her bottle, and she complained that this is not working well for me. And I took a look at the bottle. I was horrified because they gave her a humongous dose of the synthetic thing.
Oh my God.
And she's quite a patient advocate. She went back to the pharmacy and gave the pharmacist hell, which, a lot of patients wouldn't have. I'm glad she did. Now, it's, mistakes happen for sure. But it horrifies me to think that I would not have picked that up had she not brought that bottle in. Yeah.
That's why half the time nobody knows what's going on, because the disconnect in all of these different fields of medicine, right? Like there is a pretty major disconnect. Dr. Marina, I want to talk about fertility, and I want to bring up the fact that Dr. Marina is writing a book, and she feels so strongly around women's health and wellness that she actually had to pen down her thoughts into a book. So we're very excited. We're waiting for the book to show up. But until then, would you like to tell us anything about fertility, And also, I'd love to hear what you're writing about in your book.
So basically, my book doesn't have a name yet, but it is about optimizing fertility naturally. So this has, I'm bringing together a lot of the stuff I've learned in functional medicine, and even in longevity medicine, it applies here, because the lifestyle things, I mean, in order to live a long time and to be healthy, you also improve your fertility if you're going to do a lot of the same things.
So that goes back to a healthy menstrual cycle.
That's right.
To not having painful periods or spotty periods or irregular stuff. So that's part of fertility.
A big part, huge part.
Biggest part, maybe.
Part that most conventionally trained doctors know nothing about. They are not taught about the menstrual cycle and variations of the menstrual cycle and what it means for fertility and for somebody did a study and they found out that only 4% of conventionally trained doctors were taught anything about it, which is...
And this is women included, women that have the menstrual cycles as doctors.
Yes.
And they still don't know much about it medically.
No, which is quite shocking.
Well, then what are people like us going to do? We obviously know nothing. That's amazing.
It's quite shocking, but there are other practitioners who know more about it. And I've got to say that naturopaths generally are better educated in this area.
I want to know why you say that.
So they have a more holistic view of things, and they take more of a roots cause approach, like the functional medicine approach of looking like, what is the actual problem here? What is happening, which is causing these abnormalities? So, you know, I have fertility is a part of my practice. My practice, basically, I look after women from puberty to death and everything in between, whether it's problems with their menstrual cycle, whether it's contraception, whether it's, you know, fibroids, polyps, whatever, abnormal pap smears, everything.
Wow.
And fertility was always part of my practice, but it's only when I started really thinking about how functional medicine affects fertility, and in writing this book, that I recognized a lot of things. And this was actually brought on by my daughter. My daughter graduated from medical school about 1.5 years ago and started a residency program that's brutal in emergency medicine. She is a young woman who wants a family. So her request to me when she graduated from medical school, Mama, will you pay for me to freeze my eggs so that when I'm ready, I can get pregnant? And I had to step back and think about that, because I guess I get that request from patients all the time, but you don't think about your own daughter asking you this. And I said, wait, hold on. Let me think about this, because an egg is not just an egg. If you're going to freeze your eggs, you want a high quality egg. So what makes a high quality egg? Well, a lot of things. All those things that affect your health, you know, whether it's diet, exercise, stress management, toxic management, all of those are affecting the quality of her eggs. So you don't just dive in and freeze your eggs, you optimize first. So I just did heavy duty research into how do you optimize your egg quality. And I came across things that I had no idea about. Just doing this research has changed the way I practice, has changed the way I deal with young women who come in for contraception. I ask much more about their menstrual cycles than I used to. I now ask teenagers, do you think you're going to want to have kids one day? And, you know, most of them laugh it off and say, yeah, in 20 years. And I say, you know, it is important that you think about this, because don't take it for granted. You might not be able to in 20 years.
And that's the question that I was looking to ask you is, would you give a heads up to teenagers who care, like caution to the air, they don't care about anything, and they're not thinking about fertility, they're not thinking about babies, but these are real issues that they might be facing.
Absolutely. And interestingly enough, I will tell you that most teenagers actually know if they want children or not. They actually are pretty definitive. Yes, I do. Not now. Yes, I do. Or no, never. And, you know, will their ideas change? Maybe they will. But it's quite interesting. They have quite set ideas.
So what is your approach towards naturally helping fertility?
So it's like all health, issues. As I go through this in my book. I talk about diet.
Yes.
What things are important in your diet and what are not, and what has been researched. There's a lot of research on this. Talk about exercise. Extremely important for your fertility. There are links between activity and fertility. Stress management, huge. Sleep, huge. I talk a lot about genetics and how it fits in and how you can use genetics, because now, with all this genetic testing that is available, there's an area of genetics called nutrigenomics, which is the intersection of nutrition and genetics.
Oh, yes, I've heard of this term.
Yeah, so it's how you metabolize the foods that you eat, how your body processes them, including supplements. And now you can do testing specifically for fertility. I want to optimize my fertility. What do my genetics tell me I need? What kind of food do I need to eat? What kind of supplements? So I encourage this kind of testing. Now, it's still pretty expensive to get this done, so it's not for everybody, but it's available, and it's going to become part of our practices. But it's not. My daughter just went through medical school. Do you think she learned a thing about it? No, not yet. Well, when are they going to start teaching these things? I don't know. Medicine is very, very slow to change, and there's so much to learn. Our whole medical system has to change the way we teach people, because we make them memorize, enzyme systems. Memorization is not important anymore. We all have smartphones. We can look anything up. You need to learn concepts, not, memorization of pathways or whatever.
That's very interesting. It's very interesting. And I believe that all of those kind of learnings is the reason why we have a little bit of resistance in the medical community when we are looking to solve problems that they cannot really answer. Mm-hmm. It's because they don't actually know.
There's nothing a doctor hates more than a patient who comes in with the Google list, because it's difficult to explain. Now, I try to take my time and explain these things, but, time's at premium. It's difficult. I do encourage patients. I really think that they have to feel that their health is their responsibility, and they need to know these things. And that's why I'm trying to write a book that explains these things. But it's so difficult. Radha, I was just tearing my hair out. I'm rewriting a chapter on the immunology of pregnancy. This was, I think, the most difficult chapter of the book.
Wow.
It's very complex, and the testing is complex, and most of it is not even available yet, because conventional medicine says we don't know enough about it. There haven't been enough trials. But, for the woman who can't get pregnant, and she's been told you have unexplained infertility, because we don't have explanations for a lot of things. I try to unpack that as well in the book. Conventional medicine doesn't have these answers, but there's certain people who are leaders, who are doing things out there that may not be accepted, but they're helping women get pregnant with their new approaches. They just happen to be out in the forefront, and that's not everybody.
These are difficult things that you're sharing with us today, which I think women don't talk about, which as a patient, I would go and talk to my doctor about these things, but as a person or as a woman friend, maybe I'm not going to share this, because there's a taboo, especially around South Asian women. Mm-hmm. You would know there's a taboo about infertility. There is a taboo about hormonal imbalances. There is a taboo about you look sickly, or you complain too much, or it's not that big of a deal. Go see a doctor, take a pill. I feel that more so that the idea of having to wade through this kind of sea of different ideas of what people believe can be somebody else's truth when it's not, is where the real information has to come through, is where you need to, and I also feel, and I'm getting a drift here, and I'm going to ask you this because I feel that a lot of the times the left behind species is the women species. We seem to have not enough testing when it comes to hormones. We don't seem to have not enough evidence of any record of any kind of stuff happening with us. And that's not because the research is not happening, but because research is not happening on women. I feel that's one of the things that I, in my researches of looking at things and learning about them, have come across. Is that something that is actually prevalent, or is this just the way of currently the new Go Women generation is talking about, that are doctors around practice like yours, like 20, 30 years now, and they have now started coming up, and you may have heard a bunch of these names that are in the US that are so vocal about women's health and how these tests and whatnot are happening. I mean, we listen to them. These people are on Instagram, so we listen. But how much is really true around this?
Well, certainly that was true in the past, that studies tended to be carried out on men only. And I think part of the problem was, you know, depending on what you're studying, the fact that women are cycling all the time with these hormonal changes makes them more difficult to study. So that's part of the problem. I think it's slowly changing. I think they're, you know, it's been recognized that this is a problem, but certainly because of the menstrual cycle, women are more difficult to.
So I agree with that, right? So, but like you just said, your daughter just finished medical school. All the information and research that you have come across, do you think that she knows any of that through medical school learning?
The functional medicine approach, nothing of that was taught at all. She has learned a lot through me, and she does talk to patients about it, but not in. She will often guide patients to find a functional medicine doctor. You know, when there's a complex problem that conventional medicine can't deal with, she will tell them, but she doesn't do it in front of her supervisors. Because, you know, a lot of conventional doctors don't even know what functional medicine is.
I don't think anybody knows what functional medicine is. I mean, people talk about naturopaths and homeopaths and all of that. I believe that that's kind of functional too in their own ways of doing things, but we have no science that backs them up.
Oh no, there is a lot of science. It's not that it's absent. It's just it's not understood. Like functional medicine is an approach, and it's an approach that's very holistic, and it takes lifestyle into account, but it also takes genetics into account, and it takes hormones into account. It takes all of these things into account. It's just a completely different approach, and conventional doctors are not taught that way.
So you went through medical school and now you teach in the Faculty of Medicine, and you are also interested in functional medicine, but you are a trained doctor from the medical side of things, so like educated in that field. So when you talk about naturopaths, is that the same trajectory, but do they like separate themselves into something else? Like how does that work?
No, it's a completely different training, and it is much more holistic. They perhaps don't delve as deeply into certain areas, but those that are really passionate about it will get down to learn the biochemistry and the difficult stuff. And often they're better educated in their biochemistry than conventional doctors are, which probably would shock the most conventional doctors because they don't realize that.
How is that possible? Like, how is it possible that a medical doctor is less trained in biochemistry? Isn't that what we are? Isn't biochemistry the background of all of us, like the body?
It certainly is, but nobody retains everything in medical school, right? You end up retaining what you're interested in, what you specialize in. And, if you want to be really superficial, you could just make diagnoses and give people pills. And unfortunately, that's probably what's happening. What happens to a large degree without really understanding what's going on underneath. Because some of it is very difficult to understand and demands a lot of extra resources, brain resources.
Healthy brains. You said in one of the previous comments Neurotransmitters. Can you tell us about neurotransmitters?
So neurotransmitters are chemicals that basically control activities in our brain. So typical example is serotonin, because we know all about the SSRIs, which are selective serotonin reuptake inhibitors. So the theory of depression was that your serotonin is too low, and they couldn't figure out a way to boost it naturally. What they did is they made a drug that helps recycle your own serotonin.
Oh.
That's what SSRIs
are, yeah.
And this is being used for depression, and it does help some people, for sure. They often have a lot of side effects. And I don't think depression is as simple as just a lack of serotonin. First of all, there's other neurotransmitters like dopamine, norepinephrine. You know, there's tons of transmitters. Even histamine is a neurotransmitter, which probably a lot of doctors don't recognize. They all play a role. It's just not simple as a lack of or a low one neurotransmitter. So it has to be understood in a much more complex fashion. And personally, I believe that neuroinflammation or inflammation of the brain is actually a big part of depression, that it's not just to do with levels of neurotransmitters.
We talk about, you said stress management. We talk a lot about cortisol. Okay, is cortisol a neurotransmitter?
No, it's a hormone.
What's the difference between, so is serotonin a neurotransmitter, not a hormone?
It's a neurotransmitter.
And an oxytocin, is that a hormone or a neurotransmitter?
Well, but you know, some of them have dual functions.
Yes.
So it's not that simple. I mean, you're sort of taught this is this and that is that, but there is, you know, integration there. So,
Dr. Marina, I want to talk about inflammation. You said neurotransmission and you said brain inflammation. Can you talk about that?
So inflammation is an important process in our bodies. It helps us heal. So for instance, if you cut yourself, inflammation occurs in order to heal the wound. And you know, it's a very important part of our health. However, when there's too much inflammation, you can get all these chemicals that are messenger chemicals that end up gumming up other systems. And inflammation is not just caused by trauma that you need to heal from, but it can be caused by pesticides. It can be caused by, you know, the foods we eat, the chemicals we're exposed to can cause inflammation. And then these processes can affect everything in the body.
Inflammation is not a bad thing, yet every time we talk about something and women are like, oh, I have inflammation in my knee, I have inflammation in my arm. Is that a communication thing that we're trying to make it look bad?
So no, it is inflammation, like inflammation from arthritis.
Yeah.
And that's not good inflammation. I mean, it's too much inflammation. The body is trying to heal something that's going on in the joint. So there's a problem. But you can get instances of too much inflammation, and that causes pain, and that causes, you know, other problems associated with it.
So isn't that a signal? Pain is considered a signal.
It's a signal. It's a signal saying there's something wrong here. We need to fix this. So from that point of view, it's a good thing. But then it can also mess up other things that are going on.
Okay, I want to lead this into the conversation of stress management. You have mentioned it multiple times, and I know it's extremely important to conversation. Can we talk about stress management?
Absolutely.
Is it possible to give like the most layman explanation of what stresses can be?
Okay.
And what the management of it seems like?
So stress is a naturally occurring reaction to a situation, right? And in fact, it's also important. Like inflammation, it's very important. So if you we're not stressed when that saber-toothed tiger is running after you. You wouldn't run away. That's not good. Okay.
Get eaten.
So it enables the body to react in specific circumstances.
So you mean it's the flight or fight response?
Fight or freeze is now what it's called. The 3 Fs, because some people respond by freezing.
Freezing.
Yeah, which is not a good response, but
yeah, it's not good.
Yeah, so that's what it is, and that's driven by cortisol and norepinephrine. So there's 2 different body systems that create these chemicals that say, okay, you now have to run from this tiger, so I'm going to send your blood supply to your muscles. I'm going to take it away from your brain, because your brain doesn't need it right now. You're on automatic pilot. I'm going to put it into your muscles so you can run fast. I'm going to slow down your digestive system, because that's not important. Your libido's gone out the window, because that's not important. We are now, making life-saving situation important.
Oh.
So that's great for you to get away from that saber-toothed tiger. But if you're under chronic stress and you have these chemicals acting on your body chronically, you are losing, blood supply to your brain, your digestion isn't working, your libido's gone. Those are normal responses to chronic stress. So we are now living in a situation where we're chronically stressed, and we're not handling it. And our bodies are not working well because of it.
That's very interesting. So basically, the high amounts of cortisol, which is a stress hormone, which is required for us to function very well in our bodies to save our lives. That's the idea of that thing. Because it increases in the amount of how much it's being secreted, it's actually downregulating the rest of the functionality that stress hormone is supposed to have in our body.
Absolutely. So here's a central principle in medicine called the Goldilocks principle.
Okay.
Almost anything, whether it's a hormone or whether it's a cofactor to chemical reactions, almost everything has sort of an ideal amount. Too little is not good. Too much is not good. So the right amount of cortisol is great. Too little, you're not going to get out of bed in the morning. Too much, and you're going to have all this stress going on. So it's the same with hormones. So part of functional medicine is, let's optimize these hormones and chemicals to the right level. And one of the things that our labs do is they have normal values. Your thyroid stimulating hormone should be between this and this. How were those normal values made? Well, they took 100 medical students, whether they're healthy or not, measured what their values are, and said, okay, this is normal. That's not ideal. Okay, it now turns out that further studying, further research, we need to re-identify what is normal.
Sorry, I'm going to cut you off here. Are you telling me that the baselines that have been set up for these tests that we go for, and there is a level that they say, you're between an age range of such and such, and you have a range of such and such hormone, and that's normal range, that's actually not accurately done?
A lot of them are not accurate. Specifically with, pregnancy hormone levels, they tell you how many weeks pregnant you are. Completely off.
Really?
You can't follow them at all. So basically, the levels have not been studied enough that they're really meaningful.
Can I say that's because it's lack of testing on women in general?
Well, not just women. I think this happens for male values as well.
Oh, really?
That it was done a long time ago. It hasn't been updated, and practitioners now realize, for instance, the thyroid stimulating hormone is a classic example. The normal values are not good.
The TSH.
The TSH should be much narrower than it is, and in fact, it should not be used at all to follow thyroid. The active thyroid hormone is T3.
Yes.
And that is what should be followed. But for one thing, physicians are taught to give synthetic T4 instead of the active hormone because it's cheaper, ready, available. And they follow T4 levels, which is not the active hormone, okay, and TSH, which is it's not accurate. They don't follow T3, which is the active hormone. And not only that, the normal values of T3, you shouldn't just want to be in the normal. You want to be optimal, which is like 75th centile of normal. But that's not the way conventional doctors are taught to practice. They are taught, if it's in the normal range, it's okay.
Fine.
Yeah. So a naturopath will say, oh no, I don't want you normal range. I want you optimal. So I've learned a few things from my naturopathic colleagues. So I treat these things a little bit differently than I used to 20, 30 years ago.
Wow. Is that the same for cortisol? Because I feel like everybody's stressed, but then you go for a cortisol test and everything comes out normal.
So cortisol is difficult because it has what's called a diurnal variation. It should be high in the morning to get you up, and then it goes down, and by nighttime it's low. So it changes throughout the day. So when you do a blood test, you usually don't really determine the time unless you come in first thing in the morning, right? But even by then, it's not as high as when you got up in the morning. So blood testing is not very good for cortisol unless you're way off the charts one way or the other.
Okay.
So what a lot of naturopaths will do is they do salivary testing, which is good because you can do it at home. You give a saliva sample at 4 times in the day, you send it in, it gets evaluated. The conventionally trained doctors are not taught to interpret salivary cortisol levels. And in fact, the whole idea of adrenal fatigue is sort of poo-pooed by conventional medicine. It's like, does this really exist? They still don't believe it. Which, I know what burnout is. Been there. It exists.
I love that you brought up adrenal fatigue. Can you describe that before we move forward?
So it's when your body it's so exhausted by stress that it's just your adrenals are not pumping out the cortisol as they should. So your levels are low, much lower than they should be, not enough to get you up in the morning and not enough to get you going. Or you might have this imbalance where it's low in the morning and high at night and you can't sleep because all of the stress you've been through during the day. So there are different patterns that you can look at. But again, this is not conventional medicine at all. No. This is naturopathy or functional medicine. So, you're trained to understand these things if you seek the training.
Wow. One more question. No. Okay. Clearly. Clearly. Adrenal gland. Can you just quickly introduce that to us?
These are 2 little glands that are found on the top of the kidneys on each side. And they secrete a bunch of hormones. There's different parts to it. So cortisol is from the adrenal gland, but so is epinephrine and norepinephrine. It also secretes some testosterone and DHEA and some of the other hormones in lower quantities. But really, adrenals are known for the cortisol and norepinephrine and epinephrine.
Okay. I'm going to connect this to the next conversation.
Okay.
I want to talk about perimenopause. When you talk about adrenal glands and we talk about perimenopause, the idea that I understand, and I'm going to say it to you because from what I understood what it was, I'm not in the profession. So our ovaries are the ones that are functional for all of the sex hormones. So we have estrogen, progesterone, and testosterone, which are secreted by the ovaries. They are the ones that function it. But perimenopause means that we are losing the functionality of our ovaries, which means that we used to have, N number of eggs when we were like 16 or 15.
That's right.
And now by the time we're 40, 45, that N number of eggs is minus N number of eggs now. So because we start with the amount sac and we don't create more, we just deplete through its going. Tell me if I'm wrong. So when the ovaries stop making the hormones, because menopause is when it stops and the factory is completely stopped, is that the adrenals take over that functionality?
So they maintain the functionality that they had, but it's only a very small proportion. So basically your estrogen, progesterone, testosterone levels drop precipitously, but they don't drop all at once.
Precipitously, so slowly as time progresses.
So, basically, it happens at different phases in your life.
Okay.
So testosterone is usually the first one to drop, and it starts dropping in your late 30s or even early 30s, often.
What is one of the main effects of you understanding that testosterone is dropping? Is there a physical or a...
So women may feel fatigue. if their testosterone drops, or a decrease in libido would be the most common things.
So sex drive.
Sex drive.
Okay.
Yeah. So that often happens in the 30s. And in the 40s, your progesterone starts dropping.
Really?
And then in the 50s, your estrogen drops. And then when your estrogen is low, that's when your periods stop. But it doesn't happen nicely like this. It happens like this, right? Because one hormone is dropping, so the relative, you go into a relative estrogen dominance in your late 40s and 50s. So sometimes you have too much estrogen instead of too little, and you get side effects like heavier bleeding, for instance, or breast tenderness, or those kind of things. But then, depending where you are in your cycle, it may drop all of a sudden. So you get symptoms of too much and then too little. It's a really crazy period of time where some women suffer terribly from these fluctuations.
My question to you, do women have to suffer through all of this, or is there something that can be done?
There's definitely something that can be done. And it's interesting because I think it's starting to be recognized more. I'm getting more and more referrals for perimenopause, whereas family doctors used to just sort of say, oh, it's just something you have to go through. But now they're recognizing that there is treatment, and the treatment is testosterone when it's required, progesterone when it's required, and estrogen when it's required. And it's not necessarily all required at once. So natural micronized progesterone is a game changer for perimenopausal women. But
Really?
family doctors don't recognize that. And it's a very simple thing to do.
So natural micronized progesterone, is that bioidentical?
That's bioidentical, absolutely.
So it is the same thing that our body would make normally.
Yes.
But since it's stopped or has lowered the amount that it's making, so you basically replace one with one. That's the idea?
That's the idea.
And that would help perimenopausal women live their lives like nothing ever changed?
Well, I wouldn't say nothing ever changed.
Almost nothing ever changed.
We're never going to make you 20 again.
I wish. Oh my God. Okay.
Maybe one day we will. I don't know, but we're not there yet.
Are not there yet.
But what happens when progesterone goes down is your cycles start getting irregular. They start getting heavier because there's a relative increase in estrogen, because your estrogen levels haven't fallen. You start getting mood swings, hot flashes, anxiety, difficulty sleeping. That's the typical.
Sorry, Dr. Marina, I feel seen right now. I don't know. Are you talking about me? Because I don't know. Okay. Anyway, please.
So that reminds me, one of the biggest thank yous I get at the end of my day is patients saying, I have been seen. And that makes me realize that that nobody's listening to them. I just spend 5 minutes to listen, and I get more thank yous than anything as you listen to me.
That just gave me a bit of a goosebump situation, because I know what you're saying, and I feel that pain where personally, I have to say, I think I got into this a little faster than anybody else realizes that there are changes, and changes need to be looked into. But I have so many women that I'm constantly with, and I feel that they are not seen, that they are not understood. You said estrogen dominance. So that is it's a very important thing. When we talk about HRT, they talk about estrogen more than progesterone.
Yes.
I have heard that multiple doctors from the US and otherwise talk about estrogen. And then we talk about thyroid, which we did touch on, and thyroid and estrogen are not friends.
And I wouldn't say they're not friends. They do interact with each other. Lower high thyroid can definitely affect your periods. So when you have irregularity, you have to look at the thyroid as a potential reason for that. They're not at odds. I wouldn't say that.
Because I've heard that if you're on thyroid medication or TSH, clearly people need to start looking at T3. But if that's what they're being monitored for, most of the times estrogen is not, or it's not advisable to be taking estrogen. I've heard that. And cruciferous, diet, which are estrogen-friendly foods, which we know exist, eat those because that doesn't work for people with thyroid problems, or there are two, hypo and hyper. And I'm not sure which one.
No, you can replace thyroid and give estrogen replacement as well.
Yes, you can?
Yes, you can. Yeah, I do that all the time. I have a lot of hypothyroid patients on hormones, on estrogen.
Really?
Yeah.
And they respond just fine?
Yeah, most of them.
How do you monitor because you can't monitor estrogen, but you can?
You can.
Really?
Yeah, I do estradiol levels, which is one of the forms of estrogen. That is the one that we want to get to a certain level because we want to protect your bones against osteoporosis. It also protects your heart against heart disease, and it protects your brain. So I do measure levels. Conventionally, it's not measured. So that's, again, a naturopathic approach.
How do you measure them then?
It's a blood test. Yeah.
It is a blood test.
Yeah. Now, you can also measure hormones in salivary testing and dried urine spot testing. Again, conventional doctors are not taught how to do that or interpret that.
Very interesting.
So
I've also heard about hair mineral testing.
Hair mineral testing, yeah, but not for hormones. But it works for minerals and heavy metals. Yeah.
But it doesn't actually talk about hormones. It just gives you toxins in your body.
Toxins, but minerals as well.
Minerals, very interesting. I was having a conversation about minerals. I think the only minerals we know, and I'm going to be very honest, and when we have this conversation, is zinc and magnesium.
Very important ones.
Yes, but I don't think we know anything more than that on minerals. What else do we have?
Oh, I mean, there's lots of minerals.
There are, aren't they?
Yeah, sure. But many of them are in trace amounts that our body needs, like they don't need a huge amount. But they're cofactors for enzyme reactions that happen that make our body function. So they are absolutely necessary. Minerals,
Enzymes, and hormones. Is there a connection?
Oh, they're all connected. So enzymes are proteins that drive a certain reaction, like a chemical reaction. And they often work with what are called cofactors, which may be minerals or other substances. So, and vitamins. So vitamins are substances that our body cannot create, that we need to get from food or supplementation, that are important in these reactions, chemical reactions that happen in our body.
But minerals our body creates? Our body creates? No.
No, minerals we have to get from supplementation or our food. But many of them we don't need in high quantities. But magnesium you're mentioning, most people are magnesium deficient. Yes. And stress, actually, you utilize more magnesium because of stress. And that's one of the reasons that we need more magnesium.
And zinc?
Zinc is also incredibly important in a lot of hormonal reactions.
Is omega-3 a mineral?
So omega-3 is what's called a fatty acid.
Yes.
And it is naturally anti-inflammatory. So it helps with inflammation, but it's also in our membranes and our cell walls. So it's important to our structure.
It's also considered important for brain functionality.
Yes, because our brain is mostly fat, right?
And in today's day and age, when we're trying to lose weight, we're staying away from fats.
Okay. Oh, you want to get me on this topic? Okay.
I want to get you on all the topics. Are you kidding?
This is a very interesting topic. Okay, the whole low-fat craze.
It's crazy.
Was created by the sugar industry. Okay, in the 1960s, the sugar industry realized how bad sugar is. Okay, sugar is a killer.
Yes, it is.
It drives so much disease. They recognized this, and they particularly went out to confuse the public and blamed fat for obesity. And this drove the whole craze of low-fat diets that actually drove obesity even to a greater extent.
Currently, I think we are the most obese species on the planet. I think so.
For sure. Though some of our pets are getting there too.
Yeah. That's true. Wow. Okay. So we said omega-3 is a fatty acid. I want to ask you this because we're talking about fats, and I want to ask you a question, a definition of what is a lipid, where does it exist?
So a lipid is a fat. And when we talk about lipids, we're actually, when you say measure her lipids, you're talking about cholesterol mostly, and all the different parts of cholesterol, like high density lipoprotein, low density lipoprotein, and so forth. So that's generally what we're talking about in terms of lipids and what we're measuring.
Cholesterol is something that women my age seem to be shooting up in.
Yes. We usually think about cholesterol in terms of heart disease.
Yes.
Okay, as high cholesterol causes heart disease, and you should cut cholesterol from your diet. The problem is that 90% of cholesterol is formed in our bodies, not in our diet.
90%.
Yes, very high percentage. So, putting you on a low cholesterol diet is not going to change much. But the problem is that cholesterol, I think it's now being recognized that its importance in heart disease has been overestimated.
So it's not cholesterol that does heart disease mainly?
So there are other factors. And that cholesterol, yes, if you have a really high cholesterol, it has to be managed.
Yes.
But there's overuse of these medications, these statin medications that reduce cholesterol. And low cholesterol is actually a very big problem because we need cholesterol. Cholesterol is what we make our hormones out of.
See, that's what I was asking. Okay.
Okay, that's what you're getting
So
at.
the cholesterol and hormone connection is that cholesterol is where the hormones get made from.
Absolutely.
That is crazy. And everybody's like, don't eat eggs.
That information. Eggs are extremely healthy. And we shouldn't cut eggs out of our diet.
So tell me, what's the connection? So how does cholesterol help in making hormones?
Well, it's the precursor.
Okay.
No
so it's a basic requirement.
It's a basic requirement.
No cholesterol, no hormones.
No cholesterol, no hormones.
Okay, well, I'm sure nobody is no cholesterol, but people are probably low cholesterol. Does that mean it's disrupting the hormone production?
Yes. Yeah.
So when women in perimenopause come across a high cholesterol signal and they're put on statins, what is the effect of that?
So first of all, statins can really reduce vitamin B12, so you have to be careful about that. Secondly, statins have side effects. There's actually a specific genetic SNP. SNP is a single nucleotide polymorphism, big term, but it's basically for a tiny variation in a genetic sequence. And we have all of these variations. And there are people who have a variation where statins give them muscle pain. I know that because I have that SNP.
Okay.
I don't take statins, but I mean, I would be very careful about taking statins because they have a lot of negative side effects. And I think we're ruining people's health with overuse of statins.
Let's talk about menopause. Can you tell me the difference between perimenopause and menopause?
So perimenopause is the time leading up to menopause when you start getting irregularity of your cycles. You might start getting hot flashes, mood swings, difficulty sleeping, but you're still having periods, although they might be irregular.
Can I add a frozen shoulder to that mix?
So some women do experience muscle aches and pains with the hormonal fluctuations.
Okay.
But menopause is defined clinically. It's 1 year with no periods in that age group. It cannot be measured by a hormone level because there's no level that defines it. And even doctors don't realize that, unfortunately. So some of the things that we do make it difficult. For instance, the Marina IUD is an IUD that will reduce your periods or may stop it completely. So a woman in the perimenopausal age group may have a Marina and her periods stop, and we don't know if she's menopausal or not, and doing a blood test is not going to tell us. So it's makes it a little bit more difficult to decide what treatment's required.
So when a woman is in perimenopause, and they're generally aged 35 on for mostly South Asian women, I know that the age range has changed a little bit, and because there is no babies wanted at that point of time, and it's used as a contraceptive, an IUD. I actually don't know this, so I'm going to ask you that to understand. Because we cannot test perimenopause into menopause, if I was to take the IUD before the said time, which is, I don't know, age 50, 51, 52, whatever it is that the periods will completely stop. Whereas with the IUD, you don't know when they're stopped because they've stopped a long time ago. If I go into a period right after I take the IUD out, which also is probably not a scenario, it probably takes time for the body to get back into its normal flow of things to do a menstrual cycle at that age, maybe or maybe not, I don't know. Would that then help or allow a diagnosis around perimenopause or menopause, or no?
So the issue is that, if you're not perimenopausal, usually if you take the Mirena out, you get a period within 4 to 6 weeks. And then you usually pretty much go back to your regular periods.
Okay.
The problem is that if you're perimenopausal, we don't really know. You might get a period next week. You might get a period in 6 months. And as long as you're having any periods, there is a possibility of pregnancy. So really, technically, you should use condoms for a year until there's been no period for a year to be super sure. Now, of course, fertility rates are quite low at that time.
Yes.
But I've had a 52-year-old woman come in, and she thought she was menopausal, and guess what?
She was pregnant.
She was pregnant.
Oh, yes, my goodness.
Yes, so it happens. So 51 is the average age of menopause. That means you haven't had a period for a year. But under 40 is called premature.
Okay.
42, I've had a 61-year-old woman who still had periods. So that's rare, but it happens.
It's possible.
My husband swears that he delivered a 63-year-old woman when he was living in Africa 40 years ago.
Really?
Now, I don't know whether she didn't know how to count, but he swears that's possible. I have never delivered a 63-year-old woman, I can tell you that.
That's amazing. I love that. That's amazing. Okay, so it's for one whole year. So the idea of menopause is for one whole year you have no periods, but then you're not really going to know that until you're out of your IUD years, and
That's
you
right.
have to take them out in advance. So what do you suggest as somebody like me, I'm 45 and I have a couple years to go into menopause, and I have symptoms. I have the hot flashes. I can't sleep at night. I've got anxiety. I've got all of these things that you can club together and call them the perimenopausal symptoms. But then if I want to go the natural way and take the IUD out, then I should do it now. Should I do it in the next 3 years, next 5 years? What is the suggestion as a doctor?
So if you require birth control, I would keep it in. And now, I assume we're talking about a hormonal IUD?
Yes.
Mirena. So
it's the other one, Kyleena?
Kyleena.
Yeah.
Okay. Kyleena has less hormone than
Yes,
the
it
Mirena.
does. Yes.
So it's only effective for 5 years, whereas Mirena is now effective as birth control for up to 8 years.
Oh my goodness.
Okay, and that's the more common one that's being used in that age group. So I usually suggest leave it in for the 8 years. You're slowly running out of hormone, but I will still treat your perimenopausal symptoms with natural progesterone, because the synthetic progestin in the Mirena does not act like natural progesterone.
Yes.
So I will add natural progesterone on top of that.
So similar to Kyleena, it's a synthetic progesterone. It's just not the same quantity of it.
Yeah, it's a lower dose.
It's a lower dose. So it does allow the natural cycle to come through, not as effectively or as deeply as something else would, but as it normally would. But it does do it. So you would still complement that with the bioidentical progesterone.
Yes. Yeah.
And then so when would we know with Kyleena? Like I would know if my period stopped for a year.
That's right. If you go past the 5-year mark, well, you probably have to decide at the 5-year mark
whether or not I want to get pregnant or what.
Yeah, you can decide that too.
Maybe you want to deliver another 51-year-old, 52-year-old.
Well, my oldest healthy patient who I delivered is 47, 48, I believe, by the time she had her baby.
Amazing.
And this was 30 years ago.
Wow. But I do feel that we were healthier 30 years ago. I don't know. Do you feel that?
I think so. Yeah, because of our environment and our food.
Yeah, we could be more fertile for a longer period of time just because we were in a better environment altogether.
Yeah. But women who take care of themselves and look out for all of these things, I think fertility can be maintained quite a lot longer than some people would think if they're not having all these menstrual issues.
We're overusing birth control, we're overusing statins, we're telling people to cut on fats, we're making them eat low carbs. That's all of this is connected to your full health
Absolutely.
portfolio. And there's a reason why so many people are not healthy anymore.
That's right.
And have all of these issues, including autoimmune diseases, which may or may not have similar reasons of being present, plus toxins, plus stress. This is a lot of information. How important, and I think I want to close this conversation around this with you, Marina, and I think I'm going to have to bring you back because there's so much we need to talk about. But I do want to close this conversation with this question. Women's fertility and cyclical nature. How important is it on a scale of 1 to 10 for the health of a woman?
10. Simple. 10, 10, 10, 10. As I mentioned, menstrual cycles are a vital sign. They are a signal of how healthy you are. And they shouldn't be ignored. And they shouldn't be suppressed. Well, sometimes we can't help it because there are other reasons we need to suppress them. But for instance, the Mirena IUD will suppress your cycles, and that's part of the side effect. It's not unhealthy per se. However, there are certain situations where a woman has polycystic ovarian syndrome, doesn't have a period for 6 months, a year. That's an unhealthy situation because she has higher estrogen levels and it builds up the lining inside the uterus, which could create abnormal cell formation and possibly uterine cancer. So it depends on the reason why there's menstrual suppression.
Does that also result in like polyps and cysts and things? The endometrial lining being thick?
So polyps, yes, are in the endometrial lining. And we don't actually fully know the cause of polyps, though we know that estrogen has to do with it, same as fibroids.
Yeah.
I suspect it's the endocrine disruptors acting like estrogens that are causing, because we're seeing way more fibroids and polyps and endometriosis than we used to.
But something like a Mirena or a Kyleena IUD don't have any part in that.
Well, they do in that the lining stays thin, so you're less likely to develop polyps if you have a Mirena IUD in.
Okay. So it's actually better for you.
It can help that for sure. Yeah. But interestingly enough, on the other hand, some women, not all women, some women get a lot of ovarian cysts with the Mirena. I'm not sure why.
Interesting. Yeah. Some women also complain about mood swings and changes in the way they feel, going into depressive states or anxiety after they get the IUDs. Is that connected? Do you think?
Yes, I believe it is. And it's interesting, again, why only some women get that.
Yeah.
I get more complaints about the birth control pill, to tell you the truth, because I think it's the estrogen in the pill that causes a lot of the side effects. The progestin does as well for certain people. And again, I think that different people react differently. We're all different. This is the other important part of functional medicine, is that everybody is an individual and treated like an individual. There's no cookie cutter sort of treatments. It has to be individualized and personalized, and they look at genetics and these other factors.
But do you believe that physiologically we're all the same, sort of the way that our bodies are going to function?
No, because we metabolize things differently. We break down our hormones differently. We break down drugs differently. We're all different, and that's our genetics.
Menstrual cycle is what is the most important way to actually read that scale? to measure?
I believe so. And unfortunately, it's overlooked.
It is overlooked because nobody actually, every form has a question. When was your last period?
And you know why that question is there?
I have no idea.
Because you're pregnant until proven otherwise, especially in an emergency department. A woman comes in, you must exclude pregnancy for almost every potential problem that she may have, because it can affect her health. But also, you know, if you miss a problem like an ectopic pregnancy or pregnancy not in the uterus, it could be life-threatening.
Yes.
Yeah.
Yeah. Anything you'd like to say before we close?
Well, I just want to mention again about my book on optimizing fertility naturally, because hopefully it will be coming out within the next 6 months. It's my first book, and I'm self-publishing, so I don't know all the details that await me. But right now I do a weekly blog on fertility issues. I have a little download PDF about 7 tips to optimize your fertility naturally. And if people go to my website, drmarinaobgyn.com, you can get that little PDF, and you can sign up for my blog.
Wonderful. So we have Dr. Marina talking to us today. She's writing a book, and we encourage you to keep your eyes out, ready to see when the book gets published, since it's self-published, and that she is writing and rewriting, as she had mentioned, some of the chapters that are very difficult. And we'd love to see that book come out, and we'd love to be able to read it, Dr. Marina. And I think the amount of information that we sifted through today, we didn't know we were going to talk about all of this stuff. And I'm sorry, I made you put you on the spot with questions that generated because of all the things that you have said. But the link to the blog that Dr. Marina has mentioned is going to be attached to this conversation, and I encourage everybody to go look it up. I have read it, and it's very, very informative. And also, when the book comes out, we'll probably have you one more time.
Sure.
Talk about the book, and if anybody had any questions that I would be like, I'm gonna have to ask the doctor about this, get you back in here for that. Really, really appreciate your time, the effort, the time that you took away from writing your book. Thank you. Appreciate that.
It's always a pleasure to chat with you, Radha.
I am so glad. I do want to ask you one last question. When I approached you, you were, yes, let's do this. Can you tell me why you felt that you could come and sit at the Radiance chapter and talk about this?
It's interesting because, you know, since I made this decision to write this book and start this blog, it feels to me like things are falling into place for me to be able to do this. And your coming to me was just like the right timing. It's like, yes, this is what I want to talk about. This is great.
I love this. It was meant to be.
It was meant to be.
And plus, I'm very nice to talk to.
You are.
With that, we're going to see you later. Bye-bye.
Bye.
This was amazing, and the tea is absolutely. Did you drink yours? Good for you. I didn't. I'd be like what? Because I know tea bags have also micro plastics in them, Marina.
We need a sieve to sieve out the microplastics.
But we used to use sieves. Like when what I make tea at home, generally when we do make tea at home, it's with like loose tea leaves because that's the best way to do it. But then you have to sift it, and the sifters have these plastic siftings through them. So I had to go and get myself metal ones.
Yeah, the old-fashioned metal kinds.
Old-fashioned metal kinds, yeah.
Old is gold.
Old is gold. There's toxins everywhere. I mean, we have plants in the house that allow us to take the toxins out. Actually, everybody should have plants in their house. I think that's what we're missing. Yeah. What we're missing is the concrete atmosphere is making us not have greenery around us, and greenery is where the life is.
Yep.
But we don't think about that. We don't talk about that. I want to fulfill our house with like plants because they are cleaning the air. That's the natural filtration. Plus, some of the plants actually are built to take toxins in. We don't know which ones they are.
Well, you know what? Mushrooms. Mushrooms.
To grow them? Or to eat them?
Both.
I love eating mushrooms.
Both. But I don't know if you've heard of Paul Stamets. He's a mushroom expert who talks a lot about mushrooms. And he believes...
To smoke them?
That's another thing. He believes that mushrooms can be used to clean up the environment, the pollution in the environment.
Oh, you mean growing mushrooms and clean up the environment?
Yes.
Because there's suckers that suck up all kinds of bad things.
Yeah. Yeah.
Wow.
It's quite amazing. Mushrooms are an amazing thing.
Yeah.
Yeah.
Yeah.